Our goal is always to get our patients home and back into the community as productive community members. Every time we see a patient walk out, we're very excited. But we feel like we're a success if the patients are a success. My name is Jennifer Nicol. I'm the CEO of PAM Rehabilitation Hospital of Victoria. We have specific Joint Commission disease-specific accreditations in both stroke care and amputation for rehab. The physicians work together as a team in order to get the patient medically stable. It allows the patient to get back to their optimal health status because there's a lot of eyes on the health part and the rehab part of their care.
I'm Dr. Wynn. I serve as a medical officer for post-acute medical specialty rehab hospital. We are meant for a patient who has a devastating acute event such as a stroke or a loss of limb, whether it be from complication from their medical conditions such as diabetes or even traumatic event that caused a loss of limb. We're there to help rehab those individuals, hopefully back to their independence again.
My name is Lemke, and when I had my surgery, I actually woke up a quadriplegic, and I had to relearn every single thing all over again at 23 years old. When I came here, I couldn't even sit on the edge of the bed by myself, like at all. Like they had to hold me up and everything. And so I had no movement, I had no control of anything. So they had to rehab me and to teach me how to walk again, how to use my hands again, how to use my arms again. I actually was in rehab for 27 days. On the 23rd day that I was in, so less than a month, I actually got up and started walking again. When I was released on the 27th day from rehab, I actually walked out of rehab totally unassisted. Nobody touched me or anything, and I didn't have a wheelchair or nothing, so that was a pretty cool experience.
My name is Baier. I'm the director of rehab in the Victoria Hospital for post-acute medical. We have physical therapists, we have occupational therapists, we have speech therapists. We actually provide for speech therapy a thing called flexible endoscopic evaluation of swallow, or PEES. Do the procedure multiple times in a stay so we can continually watch and check for progression. What they can expect from our rehab is high quality care, very, very focused on the patient's individual goals. We've had lots of touching stories about the things the patients want, and it's really about them.
My name is Suzanne Fisher, and I'm the Rehab Medical Director at PAM Rehab Hospitals of Victoria. So types of patients that we might see would include strokes, head injuries, spinal cord injuries, joint replacements, any condition that brings about a disability in your level of function. And the goal of physiatry is to rehabilitate the whole person, addressing their rehabilitation needs, medical needs, emotional needs, and ultimately vocational needs. And so the foundation to trust is just consistency, therapists coming in when they say they're going to come in, answering questions to the best of their ability, safely handling the patients. That's the biggest thing, is that the patients feel safe as the therapist help them move in bed or help them transfer, as the therapist help them learn to swallow. It's that feeling of safety and connectedness that gets them through those difficult times. It's safe when you're here at PAM Rehabilitation Hospital of Victoria. Put your trust in the rehab team.